So Jeffhope is great. It's a student-run clinic.
So Jeffhope's a student organization.
About the fact that it's entirely student-run this lot.
It's also great because it's completely student-run.
It's a student-run organization.
So Jeffhope's a student organization that provides an opportunity to get out in the community and help people.
We want to provide equal level care to these people who are left out from the medical system.
Community and help people who are have difficulty in getting care, either financially or because they don't have access.
And secondly, we want to provide a great educational opportunity for Jefferson students.
Moses Mothra, I'm a fourth-year medical student, and I guess most recently I'm from Montreal, Canada. I've been coming out of Jeffhope since the first week of my first year here at Jefferson. It's a student-run clinic for the homeless in Philadelphia. So there are about 5 clinics now. It's organized by students every week. The students put together other fellow students, a team of students who go out along with a resident from Jefferson Hospital.
My name's Michelle DeLeon.
And I'm Christy Wasson.
And we're on the education committee for Jeffhope.
So everyone meets at 5:15. We gather at Alumni Hall to go over together. The clinic usually tries to start around 6 o'clock, so we all come. Sometimes there are first years that don't know a lot about it, so we explain how clinic runs. And then the first or second year, which is called the younger year, pairs up with someone who's older and maybe knows a little bit more.
Everybody's basically promoted one step up, so a first and second year acts like a third and fourth year, third and fourth year act like interns. So it's a learning experience for everybody.
Sure. My name is Kevin Scott. I'm one of the third-year family and community medicine residents at Jefferson Hospital in Philadelphia. So Jeffhope is a really unique organization because it was started by students, driven by students, organized by students, fundraising by students, and basically an opportunity for students both be able to contribute to the community, to interact with the community, and to develop their skills in both speaking with patients, but also to work on their skills with teaching as well. And one of the neat things about that is normally your role as a student is to be the learner, and in this case, as you move through and have more experience, you have a chance to be a teacher as well. Currently, I think go out to Eliza Shirley, which is run by the Salvation Army. It's a women and children's shelter on Mondays. Tuesdays is the Ridge Avenue Shelter, which is the main intake shelter for men in Philadelphia. Wednesday is Mercy Hospice, actually, and it's another women's and children's shelter. On Thursdays, Our Brother's Place, a smaller men's shelter in Center City, and then on Saturday, Prevention Point. It's a needle exchange clinic.
My name is Vinny Londino. I'm a second-year medical student, and I am the advocate for the Our Brother's Place Jeffhope Clinic. I get to deal with some of the problems that patients have that are preventing them from getting good care. I think the most important thing about Jeffhope is that it kind of gives the students perspective. Well, I know for first and second years, most of our time is spent in the library. And when you come to Jeffhope, you actually have an opportunity to participate in patient care. You know, some of the stuff that you might forget from a textbook, you're not going to forget if a patient told you or if a physician out here reminded you of something. So for us, it's beneficial in that regard. And it's also rewarding. You know, we get to do a service for the city of Philadelphia, get to know some of the residents out here and really get a feel for what it's like to experience obstacles to medical care. It feels good to help patients overcome that.
Here at OBP, the population is a little bit more transient, so we don't always see the same guys from week to week. So we thought the best way to get the information across that these guys would need the most would be to set up a table out in the waiting room so that while these guys are waiting, they can come by and see us. The issues that are most important at this clinic that we've found are hypertension, some diabetes or glucose intolerance, also a lot of athlete's foot, some mental health issues, STDs, all that sort of thing. It's really interactive. We have a lot of visual aids, and the guys just like talking to someone rather than just sitting there while they're waiting. So they get involved more with their health, and I think they've learned a lot and we've learned a lot, and it's been really positive here. So
I'm actually seeing a patient with Becky right now, and we're running a rapid strep test. Yeah, I'm a second year, so I've been with Jeffhope for the past about a year now. So I'm part of the lab farm committee, and what we do is sort of track all the medications and all the supplies and bring them out to clinic, make sure we've got the right stuff, and sort of help making decisions in terms of what patients should get. We dispense the meds and and do consulting. So Jeffhope's a student organization that provides an opportunity to get out in the community and help people who have difficulty in getting care. It provides a teaching opportunity as well for fourth years and interns to sort of get involved with first years, and allows an opportunity for both mentorship and for learning. So there's Lab Farm, which is what I'm part of. There's advocacy, which Tony over here is part of. There's education for diabetes and smoking and various other public health sort of teaching initiatives. There's Jeffhope for Kids, fundraising, which sort of is the backbone, I guess, of a lot of what we do. Physician coordinators and student coordinators, so they're the ones, I mean, without them, sort of the organization might fall apart. Yeah, I would say that it's an excellent opportunity for students to get involved. I mean, I think like any organization, it takes does a lot of stuff. It takes a lot of commitment. But if you're up for the challenge, I think it's a wonderful experience to really get outside the classroom and, you know, make a difference. I mean, I feel like the first couple of years when you're not really in the hospital, it's kind of frustrating at times when things you're learning to not be able to apply them. And here, I mean, we're running a strep test right now. We just a couple months ago had a whole unit on, you know, strep throat. So I mean, it really makes things real, and you get to sort of see the fruits of your labor, I think. So,
Thank you very much.
All right.